Treating eating disorders. Since eating disorders are family diseases, family treatment is the cornerstone of effectively treating the eating disorder child. It's the most effective way of treating the concerns and needs of each family member. In the presence of an eating disorder within the family system, the parents and the siblings are deeply affected, and where there are various members of the family carrying symptoms of eating disorders or disordered eating, family and recovery issues become more complex. Typically, a wedge is driven between family members due to the potency of the eating disorder. This wedge isolates the afflicted child from the rest of his or her family at the time of his or her greatest need. Also, because the tendency is for the parents to hyper-focus on their eating disorder child, the other siblings have a tendency to feel left out and are separated more from their parents. So this wedge creates a lot of unrest and tension in the family unit, creates conflict and guilt between husbands and wives, particularly for those who failed to achieve a united front in offering their parental response. What is needed for the family is a vehicle through which they can begin to understand the complexities of this disease and recovery process, a means by which each family member can communicate their own concerns and needs to the patient and with each other. Such a forum provides an opportunity for the parents and siblings to learn how best to support the child and the recovery process. The family needs personal support and bolstering in the face of what typically tends to be a lengthy, frustrating, jarring and convoluted recovery process for the entire family. Family therapy provides that vehicle. Now, it's imperative that therapists treating eating disorders are respectful of the power of a family system and the potential it has to eradicate or possibly sustain an eating disorder. The family system is the most powerful resource for the therapist to tap into. It is vital to tap into this resource as early in treatment as is appropriate and as often as is needed. The efforts made by the eating disordered child in recovery to bring about change are facilitated and enhanced not only by a family that has a willingness to deepen in their understanding about eating disorders and is willing to be supportive of the recovery process, but also by their individual and collective commitment to make their own personal and family-based changes to accommodate the needs of the changing child. In those cases where a child is showing extreme resistance to recovering, change is made within the family, the wider family system, especially the parental response to the child and the eating disorder, may be enough to evoke change within their afflicted child. Where the patient may be resistant to or geographically too removed from family involvement, a skilled therapist can conduct family treatment in absentia. I've assisted many adult eating disordered patients to successfully recover by working with them in this way. It's become very clear to me over many years now that the potential for the family unit to facilitate change is far greater than the sum of its parts. The healing process is far more effective and the child heals more completely, more sustainably, when the family is allowed to become constructively involved. The enhancement of clear communication within the family treatment recovery process eradicates the risk of breaching confidentiality. So when a child is learning to function and communicate more effectively within the context of his or her family, they carry these valuable interpersonal life skills with them into their other relationships throughout their lives. And this enables them to experience life as a healthier, happier place to be, now and in the future. I'll continue to discuss with you more about treating eating disorders in further audio tapes, recordings.